Recent foodborne outbreaks of the bacterial infection, listeriosis, in the U.S. and Canada have prompted Taiwan's Centers for Disease Control to upgrade the deadly condition to the status of a notifiable disease starting next year. With a mortality rate as high as 30%, listeria infections are caused mainly by consumption of raw or uncooked food and pose an extra risk to newborns and those with weak immune systems.
One pregnant woman who contracted a listeria infection from eating a salad also passed the bacterial infection to her unborn baby. Luckily, the lives of both were saved thanks to emergency medical intervention.
In the past few years, both Europe and the US have had large-scale outbreaks of foodborne listeriosis. There are also many people in Taiwan who eat raw fish, as well as packaged beef, duck and smoked duck, which all present the risk of possible contamination.
Every year, between 50 and 100 people in Taiwan come down with listeria infections. In its mild form, it usually causes nothing more than diarrhea, but serious cases can lead to meningitis and sepsis. The Health and Welfare Ministry is seeking to highlight the extra risk posed to pregnant mothers who can transmit listeriosis to their newborns through the placenta or the delivery process.
The mortality rate of those who contract listeriosis can be as high as 20 or 30%, and it's especially likely to lead to miscarriage or even death for pregnant women. Newborn babies who are infected are more prone to meningitis, and the elderly and those with weak immune systems may develop sepsis throughout their whole body.
Starting next year, the Health and Welfare Ministry will classify listeriosis as a Class 4 notifiable disease, meaning that each case must be reported to authorities within 72 hours. In the meantime, the ministry is working to remind the public to carefully wash ingredients and cook them thoroughly to avoid contamination.